The launch of the investment case for mental health in Uzbekistan. The investment case for mental health is a national assessment used to provide evidence-based rationale for investment in mental health. It also details the national impact that scaling up investments in prevention and treatment has in the long run. The investment case can be used to showcase the benefits of scaled-up action to relevant known health decision-makers, and as an advocacy piece to raise interest and investment in mental health. The burden of mental health conditions placed on the economy can be viewed as an iceberg. The top and visible part representing direct costs, such as how much the government spends on healthcare. In Uzbekistan, the government spends almost 1 trillion Uzbekistan sum on healthcare. The bottom and the largest part of the iceberg represents the indirect costs, such as reduced productivity and loss of workforce. These hidden costs are 5 times higher and equate to about 4 trillion sum, mainly due to loss of workforce. The economic analysis consists of 4 steps: estimating the economic burden of mental health conditions, assessing of the health impacts of interventions, costing of these interventions, and analysis of return on investment. The total economic burden of the mental health conditions on the Uzbekistan economy about 5 trillion sum. Government's healthcare expenditure represents only a fraction of all mental health-related costs. In Uzbekistan, the impacts of investing in 7 intervention packages for mental health were assessed: psychosis, bipolar disorder, depression, anxiety disorders, epilepsy, alcohol use disorders, and population-based prevention interventions. The assessment presents a viable path forward with significant yet realistic scaling up of coverage levels of these interventions between 2021 and 2030 in Uzbekistan. These will have huge impacts in reducing the adverse consequences of mental health conditions through preventive and treatment-based interventions. As treatment rates are scaled up in the population over time, the number of healthy life years gained increases markedly up to 380,000 healthy years between 2021 and 2030. The greatest impacts were observed for interventions for psychosis and epilepsy, followed by clinical interventions for depression and population-based interventions. With respect to both increased productivity gains and the social value of health over 10 years, interventions for managing and reducing the number of cases of epilepsy and depression have the highest returns on investment. In summary, mental health conditions in Uzbekistan cost almost 5 trillion sum, with over 80% of this as indirect costs to the economy. The report concludes with 4 actionable steps that Uzbekistan can take to strengthen a whole-of-government, whole-of-society approach to reduce the adverse consequences of mental health conditions and increase people's mental health and well-being, their life expectancy and quality of life. By acting now, these investments will contribute to the overall development of Uzbekistan, with positive ripple effects across society and to accelerating economic growth and social development.